cesarean delivery surgical facilities are not available, this does not even apply to you. But if you can afford it, and if you live in an area where you've seen that this improvement in cesarean delivery, where the facilities are available, is cesarean delivery on maternal request an option that we should be pursuing at this point? And what are some of the rules that need to be put in place to make sure that the population is well enlightened to make that decision? Are there any ethical implications who are watching and tracking this trend? Because face it, the rate of cesarean delivery is increasing worldwide. It is increasing worldwide. Currently, 21.1% of the most developed regions in the world, deliveries are done by cesarean delivery. 21.1% of deliveries are done by the cesarean route in the developed world. In places like the United States, it's gone as high as 35%. And in some communities in South America, they are as high as 70%, because women don't want to ruin their body. Now, the modest rate is about 14.3% for less developed nations. And we think because of the lack of access, it's about 2% for the least developed countries. But interestingly, the outcomes do not reflect the fact that the cesarean deliveries, for example, do increase maternal mortality or the infant morbidity and mortality. So even though we're doing more cesarean deliveries, it's not reflecting in any real tangible benefits as such. So it's a discussion, a debate that we should have as to whether we should resort to this more expensive. It's more expensive to do a cesarean delivery. It requires an operating room, a lot of care, and it is a surgical procedure. So we're going to open this line for debate today at the end of the hour, and we'll give you the number to call in and talk to us, share your experiences. I want us to have a very lively discussion about this today. I will guide you, give you the guidelines that we need. But we're going to take a music break at this point, and with African Woman by Becca. And when we come back, we'll pursue this topic.
There's more to life than where one begins, and which is George Weah.
I'm not setting up.
His presidency would mark the first time.
Be a good boy, be a good girl.
How did you muster the courage to call Mrs. Indu to tell her we lost or have lost £2 billion?
And still attracts me to Pastor Toby.
You know, all the stories about me and being in business, this was the worst.
Fighting climate change in particular, both in Africa and in Europe. We are interdependent.
Our intake of refugees has been going up in recent years.
Today's markets and today's life is no more a question of common sense. It's a question of knowledge, understanding we have task forces that patrol the markets, the communities, and to ensure that certain fires do not occur.
Nobody should think that he has monopoly of power. Are you able to hear? Nobody has monopoly of power or monopoly of authority. So for us in the APC, we are focused. And in the NPP who thinks that they cannot criticize them, even dogs believe that people can criticize. Only dogs who think they cannot criticize them. Anybody who cannot take criticism is a dog. And I say today that anybody who cannot my criticism, that person is a dog.
They have the natural curiosity to investigate and bring to bear stories that are closer to their roots or distant from their mood. Their fans are glued to sets to watch, hear or read, but never know who they really are when they are off the set. Enduring questions that further solidifies the bond that exists between you and your favorite media personality. Get to know them better than ever. The Other Side with Pamela Huating.
Increase in sales, or do you want to draw attention? Then mobile advertising vans from Digicat is your best bet. Our mobile advertising vans come with crisp digital images and visually impactful in the night and in the day. Reach your target audience where they live, work and play. Contact us on 0303 393 6020 or 050 132 8707.
Digicat, creativity in motion.
Zero 0302 261 468. I repeat, 0302 261 468. Cesarean delivery. Originally mythically supposed to have been a method by which Caesar was delivered in the ancient Roman times. Mother was almost dead, and Caesar Augustus was ripped out of the mother's loins and became the great leader that he was. So is that a development for mankind? Is it something that we should pursue? We do know that there are definite benefits, and that whenever there are those indications, there's no question about it, that a cesarean delivery does give some benefits for the baby and for the mother. And several very important studies have been done and recommendations made that unless there are any real problems with the mother and also for the baby that make it very difficult or impossible to have a vaginal delivery, a cesarean delivery should be avoided, and vaginal delivery should take precedence. Those were the recommendations from several very important bodies like the American College of Obstetricians and Gynecologists and the National Institutes of Health in the United States. They have no doubt that this should be the way forward for delivery, is for vaginal delivery, unless there's any extraneous circumstance for the mother or the baby. Also, they believe that cesarean delivery by maternal request should not be performed before 39 weeks of pregnancy. And the reason for that is that sometimes even the dating of the pregnancy itself can be a little bit off. And if you inadvertently go in there thinking that the baby is mature and fully ready to be delivered, you can get very disappointed. It also goes back to what I said earlier, that the birth process, being in labor, the contractions, the stress, seems to release some adrenaline and some benefit for the baby when it comes out to be able to give that first cry that makes the baby do much, much better when the baby is delivered vaginally. If you go in before 39 weeks and that baby is not, the lungs are not fully mature and developed, you can end up with a baby that comes out and is not able to breathe very well, and that can be a very serious problem. You see, during the baby's development and formation in the womb, all the body parts are formed, the brain continues to grow and develop until way after delivery it continues to grow and develop. But we do know also that the lungs especially take a long time to develop fully, and that it's only after a certain point, 38 weeks or so, that you get something called sphingomyelin and lecithin and things like that developing inside the lungs. And these are all surfactants, things that allow the lungs, once air goes in, to stay expanded and open. If these lubricating fluids are not fully developed and the baby comes out, it can have difficulty breathing on its own after it's delivered. And therefore, it's recommended that if this request be made, that the mother be very sure, both the doctor and the patient should be very sure about the dating of the pregnancy, so that you don't inadvertently deliver a very severely premature baby. Also, we believe that cesarean delivery on maternal request is not recommended for women who want more children, because like I told you earlier, if you are going to have more babies in the future, that one first cesarean delivery puts you at a much higher risk of having another cesarean delivery. And the cesarean delivery, being a surgical procedure, can have those complications that we talked about. The uterus can rupture in subsequent pregnancy and delivery, and you can have complications of damage to the bowel, the bladder, the kidneys, and all other complications that come with it. So it should only be for women who are done having babies, either that or you don't plan to have many more babies after that. We sometimes will warn women who have had 2 or 3 cesarean deliveries about the risks that they are actually incurring. And because when you go in, sometimes you can have very severe adhesions and scar tissue that then make the subsequent cesarean deliveries rather dangerous for the mother. So that request, if it's going to be made, the mother should have that thought in mind. And because most women who are requesting the cesarean delivery are doing so out of fear for pain, the pain during labor, we believe that we do have enough adequate pain control methods available in most medical facilities that the woman can usually be reassured that pain can be controlled. Nowadays, we do have all kinds of medications that can be injected that will not affect the baby too much. And also there is some spinal epidural anesthesia, and there are some that are so refined that the mother can even get up and walk with an epidural anesthesia in place that is selectively able to control the pain without affecting the mobility of the mother. And the mother can actually get up and move about, contracting effectively, but still not able to even feel the pain. So the fear for pain should not be the driving force behind a mother asking for a cesarean delivery. We can control the pain, and the pain should be controlled when women are in labor. The unavailability of effective analgesia should not be an indication or a determinant for a mother requesting to have a cesarean delivery. With all that said, we recognize that it's the woman's body, and this whole argument is based on this particular premise, that once the woman gets pregnant, even though they're pregnant, it is still their body and they have the right to do with it what they want. So we do appreciate the fact that if the woman decides that they do not want to go through labor once they've gotten pregnant, and they want to demand to have the baby removed from their body by cesarean delivery, it's their body. They have the right to make that request. What we're trying to do here today is enlighten and give you some information about the complications that can come with that decision when you go on with the cesarean delivery, so that you make an informed decision when you make that request. And also for you to realize the potential benefits for a vaginal delivery, so that you will avoid putting yourself into a situation that may not be actually that beneficial for you. But the conclusion that most people have reached is that cesarean delivery by maternal request has a potential benefit of decreased risk of hemorrhage, that's heavy bleeding from the delivery. And we all know that when we talk about maternal mortality, that's mothers dying after childbirth, most of it is usually because of hemorrhage. So there's no doubt that if you were to have a cesarean delivery, your chance of avoiding this hemorrhage and death is much better. Also, we do know that injuries to babies after cesarean delivery, injuries are decreased. And especially if you look at injuries to the baby's shoulders and limbs. Some babies are born and they're so big, the mother pushes for so long, and the delivery is so traumatic that the baby then loses function of some limbs. Some babies' heads are damaged in the process of the, childbirth, and I've said on many occasions on this show that for a human being, some of the most dangerous times of your life would have to be the time when you are coming through that birth canal with the umbilical cord being squished and with the traumatic aspects of vaginal delivery. But for the most part, on the average delivery, we're not talking about the extremes of when the baby is too large or when the baby is coming out in the wrong presentation, like a breech presentation. We are not talking about any of the clearly indicated abnormal deliveries. For a normal delivery, we still believe that the best route probably is the vaginal route and should be entertained for the most part. We therefore believe that mothers who come in with such requests should be very thoroughly counseled on an individual basis, given their very specific condition and situation, looking at all the risks involved to themselves and the risk to the mother, to the baby. So we've set in the stage here for a very lively debate and discussion. But before we get into all that, I would also like to talk about the clear indications for cesarean delivery. It breaks down into three main groups. There are very clear indications for the from the maternal point of view. If the mother has had a previous cesarean delivery, and especially if it was a classical type of cesarean delivery where the womb was cut up and down, then the risk that if the mother went into labor, the uterus itself can rupture with the contractions. And with that, there can be massive bleeding for the mother herself, for her enough to even lose her life and maybe require a blood transfusion. And also, in some of these instances, the mother can, or the baby can also be lost. So a previous cesarean section becomes a clear indication that if the mother were to request after counseling, can go on to try for a cesarean delivery. If the delivery was a cesarean, it was not a classical delivery, and the mother wants to attempt vaginal birth under very controlled and well observed situations where the baby can be monitored and where the blood products for transfusion are available, that should be an option. And then, of course, there are obstructive lesions, like if the mother had fibroids in the lower segment of the uterus that make it difficult for the baby to even engage its head down there to come through the birth canal or through the cervix, then it's a clear indication that the cesarean delivery may be a better option. And of course, we all know that there are some women who have the pelvic cavity itself shaped like that of a man. We call that android pelvis. In other words, when you look at a female, if you look at the hips, they are very different from the shape of a man's pelvis, because the woman's pelvis is described as being gynecoid, whereas the man's is android. So sometimes if the woman's pelvic cavity is shaped in such a way that even for an average sized baby, it's going to be difficult for the baby to come through the birth canal, it becomes necessary to perform a cesarean delivery. That happens fairly often enough. But also, nowadays, with our diet having changed so much, and with our sedentary lifestyle and the excessive weight gain, the increase in diabetes, for example, we are seeing that the birth weights have gone up because the bony pelvis of the mother is not increasing, but the babies are getting bigger. And so it becomes necessary sometimes where we have something called cephalopelvic disproportion, where the baby's head is bigger than the pelvis of the mother, and therefore it's indicated to do the cesarean delivery. Now, there are the fetal indications that I mentioned earlier, and that has come about with technology. Our ability to study the babies and find when the mother is in labor that the baby's heartbeat is not strong enough sometimes. And if we feel that at any point we are going to lose the baby, it becomes very expeditious to go in and remove the baby by cesarean delivery. But that's not the only situation. We're now also able to do ultrasounds. And sometimes you do an ultrasound and you realize that the baby may have some deformities or some problems that make it difficult for the baby to come down the birth canal. A good example of this may be a baby that has any kind of tumor that you think coming down the birth canal will create a problem in those instances. Or if the baby has what we call a hydrocephalus, where there's water on the brain of the baby and therefore the head is big. In those situations, it's sometimes better to go ahead and do a cesarean delivery and avoid the trauma of the baby coming down the birth canal. Of course, we are also now better able to assess when the baby is coming down in the breech presentation, and if it is not a frank breech. In other words, the hand may be coming down first, or the umbilical cord may be coming down the birth canal. We are able to determine all these things nowadays with the ultrasound machine. And if we pick these things up, then it behooves us to make sure that we do not damage a healthy baby coming down the birth canal. Infections are also very important. If the mother has HIV/AIDS and the titers of the viral titers are pretty high, you are not going to try to deliver the baby through the vaginal canal. That will be a clear indication to make sure that you deliver the baby by the cesarean route at about 38 weeks of pregnancy, and you take all the precautions to make sure that the baby is not contaminated in any way. Also, if there's active herpes infection, and we've talked about herpes simplex virus on this show on numerous occasions, if the mother has active herpetic lesions in the vagina, it's sometimes expeditious to go ahead and do a cesarean delivery. But there's a trick to that. You can always, if you know the mother has a history of herpes, you can give them anti-herpetic medications to prevent the outbreak, because you know as they get closer to delivery, they're going to be under a lot of stress. And the stress is going to induce them to have an outbreak. So you put them on prophylactic treatment about the 36th week of pregnancy, and that will prevent them from actually having active lesions at the time that they do go into labor. It's a little bit more tricky and dangerous when the mother contracts the herpes for the first time during that pregnancy and shows up in labor with active lesions over there. It will be foolhardy to go ahead and deliver the baby that way, because there's a more than 30% chance that the baby can be born and acquire the herpes simplex virus. And when a baby contracts herpes for the first time in a mother who has had it for the first time, neonatal herpes infection can be very, very devastating for a newborn baby, can lead to mortality and morbidity. So that is something that you need to be aware of, inspecting the genital area of the mother when she comes in labor, to make sure that you can advise them properly to avoid a vaginal delivery. That is not the only infection. We talked about the condyloma. Also, if there are big warts or condyloma in the perineum of the mother, these are very brittle tumors, and pieces can break off very easily and end up in the baby's throat and develop warts and condyloma on the baby's vocal cords. And these are real things that you should avoid. So these then become indications if the mother is also been in labor for a very, very long time, and you do see that the baby is going through a lot of distress with the labor. It's very important that you deliver by cesarean section. And then there are some indications that are sometimes good for both the baby and the mother. For example, if the mother had a previous cesarean birth and the afterbirth of the baby is covering the outlet of the womb, there is no way the baby can come through the placenta. So that is called placenta previa, because if the mother were even to start contracting strongly, the afterbirth can shear and separate and can lead to enough hemorrhage for the mother to lose her life. And of course, the baby also will be compromised. So that is certainly a clear indication for delivering the baby with cesarean delivery. There are other situations involved that I will not bore you with, but for example, if the mother has a heart condition or a lung condition that prevents them from being able to take in a deep breath and push down really hard to push the baby out, that might also be an indication for doing the cesarean delivery and getting the baby out that way. And so, but for the most part, I think we have very clear indications that when everything has gone right and the baby is not too big, the mother is otherwise very healthy, has exercised, and is capable of pushing the baby through the birth canal, it is safe to deliver the baby vaginally. The human body can stretch. The vagina can stretch. And for the most part, most deliveries do not even require episiotomies or the cuts that women are so afraid of. I have done numerous deliveries where there was not a single scratch or even a tear in the vaginal area. That is the norm. What we hear about of all the difficult, prolonged labors with tears in the vaginal area going all the way down to the rectum to be repaired and the fistulas, those are outliers. They are not the norm. So that big fear is a myth. For the most part, if a woman has gotten very good prenatal care, has avoided weight gain, excessive weight gain, has stuck to a very good regimen of a diet and exercise, and the abdominal muscles are strong, she should be able to go through normal labor with support from family and from the midwife or the healthcare practitioners, and have adequate pain control to be able to, with very good gentle perineal massage, have a vaginal delivery that is free of any lacerations, episiotomies, or any tears. That is the norm. So let's encourage that more. You have to be prepared with the prenatal care to make sure that you are aiming for a very good and worthy experience of being in labor, listening to soothing music, having your husband around to share the experience, rather than a scheduled going in and having a surgical delivery. Most of the time, you can even be put to sleep and wake up only to see that you have a baby. You miss out on that experience. I'm not being biased here. I'm just giving you the facts as they are. And the numbers to call will be 0302 261 468. And when we're going to take a music break, as usual, when we come back, we'll continue this conversation, and then we'll open the lines up. I Recall a Gypsy Woman by Don Williams.
Fighting climate change in particular, both in Africa and in Europe, we are interdependent.
Our intake of refugees has been going up in recent years.
Today's markets and today's life is no more a question of common sense. It's a question of knowledge, understanding.
We have task forces that patrol the markets, the communities, and to ensure that certain fires do not occur.